A very good morning to all of you. This is Dr. Bindu Priya. I am a consultant urogynecologist from KIMS Hospital, Secunderabad. In today's topic, let us discuss about one of the common problem that we see in our clinical practice, that is fibroid uterus. So basically, what is this fibroid uterus? So fibroid is nothing but it's a tumor in the uterine cavity. So tumor is nothing but the uterine muscles at a certain point of time, at a certain place, they overgrow and become a small tumor kind of thing. So these are called fibroid uterus. So why does this happen? And there is definitely no one answer for this, because this is like a multifactorial disease. So there are certain so many factors that is contributing to this fibroid uterus problem. It can be because of the genetic tendency. So wherein the woman is because of her genetic predisposition, she is increased risk for this fibroid uterus. And there are certain risk factors for this fibroid uterus, especially obesity, because in obesity there is something called excess estrogen production. Estrogen is nothing but a female hormone which is responsible for the growth of these fibroids. So in obesity and then in certain kind of fertility related problems, we commonly see this fibroid related issues. And these days whatever like we are seeing is like very huge fibroids, and definitely we don't know the answer. Probably certain chemicals in our daily activities, or maybe the chemicals that we are ingesting through our food, the chemicals that are being ingested through the air. There is no one answer for this, but probably this could be one of the reason for this fibroid issues as well. And what kind of problems can the woman face with these fibroids? So basically, sometimes they can be just incidentally detected fibroids. So when the woman goes for some other problem and when an ultrasound is being done, that is when these fibroids are detected. So in such cases, if the woman is not symptomatic and if the fibroid is small in size, there is nothing to panic. They can be managed conservatively, and we usually ask for a follow-up like every 6 months to 1 year to just look for the growth of these fibroids. And in case if the woman is symptomatic, what kind of symptoms the woman can experience? So it can be heavy menstrual bleeding. So whenever the woman is getting periods, because of this fibroids, she can experience heavy amount of bleeding. So and this can last for like more than 1 week or so, with passage of big clots. Usually menstrual blood, we don't see clots. In case if the woman is passing clots, it means that she is bleeding heavily. And sometimes there can be very severe pain in periods. This we call it as dysmenorrhea. Sometimes this dysmenorrhea or this period pain happens along with periods. Sometimes it can happen even 1 week prior to periods, depending on again the site and size of fibroids. This dysmenorrhea again can vary from person to person. Sometimes because of this fibroids, the woman can have problems in conceiving, especially if the fibroid is there in the inner layer of uterus. So there can be sometimes problems with implantation, and it can end up as recurrent miscarriages. And sometimes if the fibroid is big enough in size, sometimes the woman can have second trimester miscarriage. So second trimester is like after 14 weeks of pregnancy, because of this fibroid issues, because of the alteration in the shape of the uterus, the pregnancy can end up as a miscarriage. We call it as second trimester abortion. And sometimes the periods can happen very early. So we call it as polymenorrhea. So again, fibroids can be one of the reason for this. And if the fibroids are very big in size, so the woman can have some heaviness or some kind of pain in her lower tummy. And there can be problems even with sexual intercourse. So we call it as sexual dysfunction. Now, what are the treatment options available for this fibroid uterus? So as we already discussed, so if the fibroid is asymptomatic, probably we just put them under follow-up. If the fibroid is symptomatic, then depending on the age of the patient, depending on the fertility desire of the patient, depending on where exactly the fibroid is located, there can be several treatment options available. So sometimes medical management, so wherein we manage these fibroids with drugs. Sometimes even surgical management, so wherein we have to go for surgical removal of either the fibroid, or if the family is completed and if the woman is above 40 years of age, sometimes along with fibroid we usually remove the uterus also. So this is called as hysterectomy. And even non-surgical options are also available. This we call it as uterine artery embolization, wherein with some tiny particles we just block the feeding vessels of this fibroid. So this we call it as uterine artery embolization. Again, these kind of treatment options can be suitable for a certain group of women. So depending on the symptoms, depending on the size, depending on the age, so there are so many factors that we need to consider before treating a woman for fibroids. So and as already already I said, so hearing this word fibroid, there is nothing to panic. So definitely you can consult your gynecologist, and depending on the symptoms, definitely we can guide you for this fibroid problem. Thank you.